Hey, I'm JC Warbeck.
And I'm Clarissa Scheidel. We
We're
are the founders of Three Putt Golf Co.
As avid golfers, we could never find ladies' golf clothing that was comfortable and stylish.
So we decided to create our own brand that is fashionable, comfortable, and size inclusive up to 3X.
Each three-putt piece is uniquely ours. Check out our collection at threeputtgolfco.ca or visit our socials under Three Putt Golf Co.
And remember, 3 putts build character.
Hello and welcome to the Unexpected Journeys podcast. I'm your host, Stacey Comer, and in this podcast, we talk to people who have had something unexpected happen in their life that has changed their path, or they're helping others who have had something unexpected in their life. And I'm excited to be joined today by Kristen Traverse. Kristen, we'll get into your story in a little bit, but first of all, thank you so much for joining me today.
Thank you for having me. It's lovely to talk to you.
Well, Kristen, you had a stroke back in 2015 that was a terrible situation and that you had to recover from. And just to show that all that you have accomplished since then, I just want to talk a little bit about your background. So you're a registered nurse, and you since you've gone through the recovery process, you have your neuromovement practitioner certification and osteopathic therapist post-diploma. So you've advanced your nursing education, and you're right now finishing up your master's in education for health professionals from the U of S. So tell me what all that means, first of all, into how you are helping people today.
Well, I mean, again, when you have an unexpected thing happen, you kind of have to pivot, and as you know. And so with part of my recovery was just trying to find something that I could, enhance my brain with, something that I was interested in. And I had all of this time to kind of contemplate what I wanted to do and how I want to help people. So it is a long story on how I have taken those things. But so again, if there was something that I found, like there was something that wasn't addressed, I was like, okay, how can I, take my education to kind of advance that?
Mm-hmm.
And so with neuromovement practitioner, I actually was approached. This was years after the stroke. I kind of took courses in neuroscience and became certified in mental health and developmental health with nursing, and board certified in neuroscience. And like that kind of was the pathway for me to recover because there was not a lot of extra things to do. So I was like, okay, I have the resources, I have the time, I'm going to take these things. And it was actually a school division that approached me, that they were looking for a pilot project, someone to lead the pilot project. And it was to bring neuroscience and the elements of neuroplasticity into education. And it's never been done before. This is called the Anot-Banal method,
Okay.
neuromovement. And it was kind of like this forefront of like what is now part of the mainstream, like neuroscience and nervous system regulation and all of these things. And so yeah, they approached me, and I was really contemplating what I'm going to do with my life, because I don't know if like going back to the typical job that I had before, which is dialysis chronic disease educator, was for me, because I like had lots of fatigue. I had lots of like post-stroke things that were happening. And so, yeah, I kind of was like, we contemplated it. It made sense. I explored it more. And then actually they flew me down to San Francisco, and I met the founder of the Anot-Banal method.
Oh, okay.
Yeah, and it was mind-blowing. Like the results that were happening were mind-blowing. Like autistic, it's made for anyone. It's made for all of, if you have a brain, you can benefit from it.
Right.
But we really I looked at it with like neurodiverse students, and like people that were autistic weren't speaking, and now they're speaking. Cerebral palsy people that had cerebral palsy were like less spastic and more comfortable, like all of those things. And so I really it really struck me that this is something that I need to look into. And I eventually took the training, which is like a very extensive, like couple-year training, and back and forth to, the States and here and all of these things. And so anyways, that's why I became a neuromovement practitioner, is I brought this into the schools with other people as well.
And are you doing that now still in the schools, Kristen?
I am, yeah. So I'm a lead of like a consultant. I'm lead of it used to be a pilot project, but we saw such good results now. It's a program. I built up a team so they can kind of do a lot of the things in the schools. I'm still very much involved, but again, my health is very interesting. So I again have to kind of pivot, and my kids are getting bigger,
Yeah.
and I don't have much time left with them, to be honest. And so I'm trying to take some time to just be at home and be with the kids and work on my health. And still, still be involved in the schools and all that kind of stuff. And I mean, it's been good.
Well, I want to go back, Kristen, to 2015, which is when you had your stroke. So can you walk me through that day and also just talk a little bit about the misdiagnosis initially?
So yeah, I was working in dialysis at that time, living in Kitscoty. We were building our house, like everything was busy and
Happening.
yeah, and I had a 4-year-old and a 1-year-old. Like I just went back to work. I was working part-time, and I think I was back to work maybe like 2 weeks. And I don't think my younger son was even weaned at that stage. Like it was just like a chaotic time. Yeah, so I was driving into work, and thank God we started early. It was about 5:30 in the morning. And I just felt this sudden wave of confusion wash over me. And I remember like driving and looking in this, like at the speedometer, and it just kept going up and up and up. And I was like, slow down. And I couldn't tell my foot to slow down. I couldn't, like, it was just the most bizarre out of body experience. And yeah, I just remember going so fast. And thankfully, no one was there on the highway because it was so. And I remember blowing past stop signs. I got approached Lloyd. I remember blowing past stoplights and thinking like, why am I not slowing down? And I don't know how I got there, to be honest. I don't really have that memory, but I ended up by the hospital, close to the parking lot, kind of like parked on a curb with my door open. And in my head, I was going to work. So I'm not too sure how I got there, but thankfully someone was looking out for me because I didn't get in an accident. I didn't hurt anyone else. But yeah, I went into the hospital and the doors open and you don't really have to do anything to get to my unit, whatever. And so I ended up going to my unit and trying to I think nurse. Vision was funny. Someone said hello to me and I couldn't get out anything. And then it was my manager that's like, something's not right.
Yeah.
So she, rushed me to emerge. I was like, in my head, I'm like, no, we're fine. I'm okay. But yeah, I went to emerge. And then of course the nurses know me and they knew I was not acting appropriately. And they rushed me back and did a phenomenal job at triage.
And was there a misdiagnosis at first, Kristen? Or was it the stroke immediately? It was known immediately?
No. So the nurses suspected stroke. So there is, we can go over what signs and symptoms, but I could not speak. Like usually, it's called FAST, face. If there's one side of the face that's drooping, I didn't have a lot of that. Not like an obvious sign of that right now, like at that stage. But I couldn't speak. It's like face, arms. So if you lift your arms and one arm droops.
Okay.
That wasn't affecting me at all. Like I didn't have any physical impairments, but I couldn't speak. The other one is fast as speech. I could not speak at all. As much as I tried, nothing would come out. And then time is like 1.9, I think, billion neurons die each minute you wait to get treatment. Wow. So yeah, they triaged me. They suspected stroke, and so they put me back in the room. And because I was 31, I wasn't on birth control. I was a new mom. I marathon runner at that stage. I think I ran 13 kilometers the day before I had the stroke. Wow. So the doctor looked at me and thought maybe it was a migraine, and he just kind of let it linger a little bit, and it's like, she'll get better. It's migraine, whatever. And because I was having the stroke at that stage. Like it was happening there, like at that stage. I don't even think it showed up on a CT at that stage, but I had lots of signs. But again, when you're young and healthy, and I did have a history of migraines, which never affected me that way, but
Yeah.
so it was a long, like, couple hours wait, and I missed that window. There's a window if you have a clot in your brain. They give you a medication called TPA, and it is like a clot buster. And I missed that window. So eventually, like the nurses, and my sister's a nurse as well, they really advocated for me to like go to a different hospital that I could get an MRI and just see what was happening. And then I remember going to the U of A and had an MRI, and it was quite an extensive stroke.
Well, and Kristen, do you think like leading up to it now, were there any signs ahead of time at all? Did you experience anything that maybe you think back, okay, well, that this tells me that I was maybe headed for a stroke, or was there absolutely nothing that indicated that this was possibly coming?
No, like if someone is at risk of having a stroke, there could be like, it's called TIA, like transient ischemic attacks, where there could be like kind of a loss of brain function and then it just resumes. But I didn't have any of that. I had like, it's called an cryptogenic stroke. Like I didn't have any signs or symptoms, didn't have any like cause. We still don't exactly know why I had the stroke. I did have a hole in my heart that we found out later, and like typical migraines with auras, and you have that kind of trifecta. If you have both of those, it can possibly lead to an increased risk of stroke, but we still don't know why I had the stroke.
Well, and Kristen, you mentioned when this happened. So you were 31. You were basically the picture of health. You know, you had ran the 13 kilometers a day before, which is not out of the ordinary. So you weren't pushing yourself because you were a runner. And then you still had the stroke at such a young age. So why, Kristen, is it important that you are continuing to educate people that this is not something that just happens to people of a certain age group or with certain health issues? Why do you I know when after you were started making your recovery, you were telling your story a lot to get the awareness out. And why is it important to have that awareness?
Strokes don't discriminate. No health issue discriminates. I do feel like I was possibly misdiagnosed because I was the picture of health and because I was so young. And yeah, it's funny that you say that. I haven't actually done these like podcast or anything in quite some time. Like I when I first got diagnosed, I had to make meaning of this, I think, to be honest. And I had to like help people. But then I needed to take some time to heal. There's that old adage, like you teach from healed scars, not open wounds. And so now I feel like I'm ready to talk about it a bit. But
Well, another thing too is that I can't imagine, as somebody who, again, your age, you've got this family, you've got so much on the go, and now because you ended up having to learn how to speak again, and now you've got to go through this recovery. So can you recall when you started going through the recovery, like what kind of a mental toll does that take on you, and how do you prepare when you've already been through something, so difficult health-wise, and now you have to do all of this recovery?
yeah, so I eventually got diagnosed with Broca's aphasia, like severe Broca's aphasia. So part of the brain that's responsible for speech and expressive speech, I lost that. I also lost the ability to like know numbers or understand directions. I was really bad at directions before anyways. My husband reminds me that all the time. But like all of those things I had to relearn. And I'm fortunate too, because I'm young. I was young. I had that working for me. Like my brain was really plastic. I had the education behind me. I had the family support around me. I had the resources. So I was super fortunate, and I always know that. But yeah, I think it's a mindset shift. And I do feel like your circumstances don't define you, and it's what you make of it. Like everyone has trauma, everyone has something, and it's what you do with it. And I feel like I just knew that my kids deserved a mom that was present, that could speak to them, that could help them read and write. And honestly, it was interesting because my older son was just learning to read, like he was 4.5, and just kind of like learning like ABCs. And then my younger son was just learning to speak. And he was, a 1.5 years. And I learned with them. And I just had to remind myself that it's like there's no perfectionist in this. Like
Yeah.
I still am a little bit of a perfectionist, and I have to remind myself that you just have to get up and keep trying, and one foot in front of the other, and you're going to fail miserably, and that's how you learn.
At 3-Putt Golf Co., we designed everything from the bottom up, so each piece is uniquely ours. We create golf apparel that looks good and moves with you. We are a Canadian company based out of Saskatchewan, and you can check out our full collection at 3puttgolfco.ca. You can also check out our social media handles at 3Putt Golf Co. Remember, 3 putts build character.
One thing you mentioned, Kristen, you touched on a little bit about was having the family around. How important was it during this time to have, the support of the family and friends to just, because it had to be tough at sometimes too. So even just to give you the motivation, and even if it was something like, hey, let's go for a walk, or, let's have coffee or something like that. How important was it to have all of that support during your recovery?
Oh, immensely. Like, I don't think I would be here if I didn't have, like, my husband is the most phenomenal, kind man that he just does whatever he needs to do. And it was my sister and my husband and my mom that, like, everyone was taking me to, my rehab appointments, and just the people, like the friends that showed up and were kind, and just, I couldn't speak for a long time. And it was really like, it was interesting because I knew exactly what I wanted to say, but then there was a disconnect. And I felt embarrassed at times. Like I couldn't speak. I couldn't be articulate. I thought everyone thought I was stupid. And the people that, rallied around me and just, gave me that motivation to just keep going. And you know what? It's those tangible things, like to show up to go for coffee, or to take care of my kids, or to take them to the park so I could rest. Like, that was a huge support.
And Kristen, being a nurse going through this, is that a little bit different, do you think, than somebody who maybe doesn't have that nursing background? And was it tougher for you going through because you know the procedure, and also switching from the role of a caregiver to somebody who was being cared for?
Right. Yes, because it's hard for me to turn off my nurse brain. And especially when I was going through that, I could not express myself, right? I knew, like, when the dust settled and I kind of came back to my awareness, like I knew something was wrong, and I knew I probably have a stroke. But I could not say that. I couldn't advocate for myself. I couldn't, like, all of those things. I couldn't order a coffee. So it was really important to, like, just take a step back, let, my sister advocate for me, or all of those things, to just be like, okay, but it gave me such a different perspective. And I think I was always an empathetic and kind nurse, but it just gave me a perspective that those, like, the extra time that you spend with the patient matters. The more you give to the patient matters, because, I was in that boat, and I was in the hospital bed, and I see, like, what matters and what doesn't. And yeah, that just the amount of caring that the nurses did was phenomenal. And it just kind of gave me a different perspective on, like, what we do matters.
Yeah.
And, yeah. I've always thought it was a privilege to be a nurse and be there for, like, the lowest and highest points. But yeah, it just gave me a different perspective, and that does really, really matter.
Kristen, do you have any symptoms today that you are dealing with still from the stroke, or would you consider yourself fully recovered, or are you ever fully recovered from a stroke?
Good question. I don't honestly think you're ever fully recovered from a stroke. You are kind of irrevocably changed, because you have this, like, traumatic event. It changes your brain, and all of these things. I think people think I'm recovered, but I still struggle with you know, how I'm expressing myself, and there's a bazillion things that I would have said different, but I just have like this um, amount of like words in the back of my head that I can just pull from. So like even me and you talking is a little bit nerve-wracking for me, because I don't know if I said that exactly how I wanted to say that. But again, I can't be perfect, and we just need to
Right. So in essence, it's probably different for everybody's recovery too, and depending on the type of stroke you had too. But it's probably, is it something, Kristen, that is kind of always in the back of your mind too?
Uh, not at this stage, but yes, it was for quite some time. It was.
Mm-hmm.
And I do feel like I still struggle with, aphasia a little bit and fatigue. And when I had the stroke, it kind of set off like this kamikaze of events with my, I'm genetically predisposed to autoimmune stuff too. So it kind of like set off all of these things as well. So, but yeah, I think every stroke is different. Every recovery is different. And like, just give yourself some grace.
Well, what do you think, Kristen, is the biggest myth that people believe about strokes and cardiovascular health? Is there something out there that is maybe you think is misinformation out there?
Well, I think that people assume that it just affects the elderly or the inactive or like unhealthy people. And
Mm-hmm.
I mean, health is a spectrum, right? So cardiovascular disease and stroke affect like anyone from infancy to elderly. And it doesn't necessarily, I think sometimes people feel like there's like a moral judgment, like, you know, if you had a heart attack or a stroke, you must be unhealthy.
Mm-hmm.
That is not the case at all. It does not discriminate. Know your signs, look after your health. But honestly, it is one of the things that does not discriminate, and you can be affected anytime.
Well, you kind of went over this before, Kristen, but I would like to let our listeners know again, because this happened to you, like you said, when you were so young. Is there a difference in signs for women as compared to men? And just in general, what are those signs that you talked about fast? Can you kind of go over that again? That if it's happening to somebody, so they are aware, because you said that window is so important to make sure that you get help.
Yeah, with strokes, typically they affect men and women the same. Because it's it's sudden loss of brain cells, whether it's a bleed or a clot or whatever, it's that sudden loss of brain function. So you can get like a thunderclap headache, like the worst headache that you've ever had. Loss of balance, like sudden. We say sudden because it is like all of a sudden there's an interruption of that flow of oxygen to that brain, so brain cells, so it starts to die. But yeah, it's like face. We always talk like if there's a noticeable droop in the face, speech, if you're slurring, if you can't get out words, arms. So we like there is a sudden loss of feeling of like numbness and inability to move on one side, and then time. Like we want you to call the ambulance. A lot of the time too, like back when I had the stroke and a couple of years later, I went back to work as a stroke coordinator and in a very like small window of time.
Mm-hmm.
And so many people showed up to the hospital with stroke symptoms. Someone drove them, which is fine, get to the hospital.
Yeah.
But when you call an ambulance, you set off this pathway where people expect you to come to the hospital, and it's just the less time, the better to get treatment.
Well, and Kristen, you mentioned like you're doing some things in the schools, or you have a team that's doing that too. Is there anything else like in the hospitals and stuff that you're doing as well, or are you just sticking to, like you said, kind of easing back a little bit with your family and just having the team take over, or are you looking getting back into more educational things again, or is it everything is kind of good the way that it is now?
I struggle with that, so I'm always looking for things to do.
Yeah.
But I'm trying to hold myself back a little bit. But no, I with this neuromovement method, like a not banal method, it works with people with stroke. So I've seen clients like privately that kind of stuff. And I'm always developing courses and trying to teach, like part of the course that, or part of the program that I do in the schools is I teach EAs about brains and, learning and neuroplasticity and all, like how brains can change, and to give the conditions that brains can change. So yeah, I'm always doing that, and developing workshops and all of those things too.
So you're still keeping busy, basically. Nothing has really changed on that end.
No.
What does a typical day in the life look like for you now, Kristen? Post recovery, and we got your kids that are home, and like you said, they get older, and unfortunately, at some point, they're also going to be likely away from the nest as well. So, are you really just focusing on family now, or what's your typical day kind of look like for you?
I am really focusing on family now. My husband and I kind of had this realization, like life is so short. And so we're trying to do as many experiences with kids and travel as much as we can. Again, like I do have some autoimmune issues that are progressing. So we're trying to kind of explore the world while we can. But yeah, like I do feel like my typical day is, be with kids and make sure I run them everywhere because they're so busy. And then when I get a chance to, I still look at, work and all of those things too. But right now, the priority is family.
Well, if somebody, Kristen, has had a stroke, or if they have a family member that has had a stroke, what's the best advice you can give to them if they're having if they're the stroke victim and are having trouble with recovery, or if it's a family member who is maybe, feels helpless because they see this person going through recovery, they're not the same person right now. Can you advise on both sides of things what your best words of encouragement could be on both sides?
Yeah, and I think everyone is very individual. But for someone that just is recovering from a stroke, like it gets better. I remember thinking that it wouldn't get better at certain stages. Like it was just hard. Life was so hard for a long time. And I remember thinking like, this is it. Oh gosh, this is it. But it gets better, like your brain recovers, you learn new things, you experience new things, and it does get easier. Just keep putting one foot in front of the other. And for someone that is caring for someone that had a stroke, give them grace. And anyone, give them grace, and just, yeah, like give them space to grieve. Because I think sometimes people are like, no, you got to do this, you got to do this. But this is a huge life changing event. And you lose your identity. And, you have to realize who you are without those abilities. And that was a challenge for me to realize who I am with, and it all came back, like, my knowledge and all of this stuff came back in different ways. But again, it was like, who am I without, like me nursing? Or who am I without me being able to speak or articulate, or all of these things that make you who you are? Who are you? So it's going to be a challenge, but at the same time, it will get better. You'll figure it out. And for someone that is like taking care of someone with a stroke, or friends and families, like offer tangible help. I do feel like sometimes people are like, well, how can I help? But if you mow the lawn, or, pick up groceries, or take care of the kids, or whatever that looks like for that individual, that's a huge, huge help, because people don't people don't want to ask for help. And for me, in that moment, like I did not want to ask for help. I did not want to feel vulnerable. And I did not, it was really hard to find that strength and vulnerability. And so if someone, picked up groceries for me or took the kids to the park, that was just a huge, huge help.
So it's the little things that are the biggest help.
Absolutely. Yeah, absolutely.
Kristen, thank you so much for joining me today and talking about your experience. I know you've taken a break from it for a while, but I do appreciate you telling me your story and also helping to educate. And hopefully, if there's somebody that listens and is having symptoms or comes, somewhere in the future where they see somebody else with those symptoms, they will have a better idea of what to do. So your advocacy has been phenomenal. And I'm glad to hear that, you have so much on the go and things have improved so much. And again, I very much appreciate your time today.
Thank you very much, Stacey.
Unexpected Journeys is produced and hosted by me, Stacey Comer. Executive producer is Sean Lannon. Podcast and host representation is Lemmon Entertainment. Thank you to our episode sponsor, 3Putt Golf Co. You can find us on all social media and podcast sites under the name Unexpected Journeys. Please like and subscribe wherever you're listening to us. We appreciate any and all feedback, and if you are interested in being a guest on the Unexpected Journeys podcast, you can email us at unexpectedjourneyspod@gmail.com. For sponsorship inquiries, send a message to jessica@lemmonent.com. That's lemon with 2 M's. Thank you so much for listening.